These case studies are provided to stimulate discussion and are not intended to represent actual legal advice. They are based on the South African Pharmacy Council's Code of Conduct, and the ethical considerations are numerous and complex. Let's delve into a few of these scenarios. When we consider the evolving role of pharmacists, several ethical dilemmas can arise concerning the boundaries of our scope. Scenario 1. Advanced Practice and Referral. They are based on the South African Pharmacy Council's Code of Conduct, and the ethical considerations are numerous and complex. A pharmacist has completed advanced training in managing chronic diseases and is now comfortable initiating certain medications within a defined protocol. A patient presents with symptoms that, while manageable by the pharmacist, also warrant a physician's assessment for a broader differential diagnosis. Ethical dilemma. Advanced training and expanded scope of practice offer greater patient benefits when provided within the bounds of a pharmacist's expertise. However, the scenario highlights the ethical quandary of deciding when to refer a patient for a physician's assessment. This ethical dilemma revolves around the balance between providing patient-centered care and avoiding overstepping one's professional boundaries. It touches upon the SAPC's emphasis on acting in the best interest of the patient and maintaining professional competence. While the pharmacist's advanced training is commendable and likely beneficial to many patients, it's crucial to recognize the limits of their expertise. There may be instances where a patient's presenting complaint, although seemingly straightforward, might actually be a manifestation of a more complex underlying condition. In such cases, referring the patient for a physician's assessment would be the more prudent and ethical course of action. This ensures that the patient receives the comprehensive evaluation and management that their condition demands, ultimately serving the patient's best interest. Scenario 2. Collaboration and delegation. A pharmacy technician, under the direct supervision of a pharmacist, is trained to administer certain vaccines. The pharmacist is overwhelmed with dispensing duties and is considering allowing the technician to administer vaccines to a queue of patients while the pharmacist briefly steps away to manage a critical dispensing task. Ethical dilemma. This scenario delves into the complexities of delegation and supervision. While pharmacy technicians are permitted to administer certain vaccines under the direct supervision of a pharmacist, the question remains as to whether the pharmacist can be held accountable. If the technician makes an error while the pharmacist is occupied with another task, this touches upon the SAPC's emphasis on the responsible delegation of tasks and the importance of direct supervision. Even when utilizing the skills of other healthcare professionals, the supervising pharmacist must ensure that the quality and safety of pharmaceutical care are not compromised. The scenario underscores the need for clear protocols, effective communication, and a system of checks and balances to mitigate risks and ensure patient safety. These scenarios are provided to stimulate discussion and are not intended to represent actual legal advice.